when you have UnitedHealth down 8% in a day, that tells you there's something out there they hadn't previously factored in. What do you think that is?
Good afternoon. We think it's 75% Bernie and 25% coronavirus. One thing I'd mention, we went back and looked at the last really bad flu season, which was 17 and 18. And if you look at the big four insurers, the medical loss ratio actually went down for 2 of the 4 and was only up slightly at United. The only insurer that took a hit was Humana, which has a lot more Medicare Advantage. So if we're worried about widespread loss ratios inflating, the data doesn't support that.
Right. So you're saying basically the 25% worry, which is about coronavirus, is not really justified. So let's talk about the 75%. People have known Bernie Sanders is in the race. They know about Medicare for all. What's changed?
I think the margin of victory in Nevada surprised people. Yeah, I'll give you 3 quick reasons why we don't think it'll happen. But if it does happen, it's a nuclear bomb for the industry. So the 3 reasons it won't happen: 80% of Americans are happy with their private insurance. 90% of seniors are happy with Medicare Advantage. Number 2, if we paid Medicare rates to U.S. hospitals, most of them would roll up the doors. Medicare margins are minus 11%.
Right.
Number 3, we got 1 million people working in the health insurance industry. I doubt Senator Klobuchar wants to roll the carpets up at UnitedHealth in Minneapolis. So, and fourthly, I said 3, but fourthly, U.S. reps don't want to see hospital closings in their districts. So it won't happen. We put the odds at less than 1%. But it's one of those things, a 1% chance of an asteroid is still a 1% chance of an asteroid. Sure,
and it's being priced in. Let's say that chance is a little bit higher than previous. Let me just ask you this. If the public says the healthcare system is broken, we want a better public option, if nothing else, if we just advance a better public option, what does that mean for stocks like UnitedHealthcare?
I think you're spot on. So if you look at the reason Obamacare is popular is because it failed. Meaning we were supposed to have 25 million or so people on the exchanges. We have less than half that. So employers didn't dump people on the exchanges willy-nilly. Most people kept their private insurance. But I do think people want to know there's something there if they lose their jobs. And the exchanges just don't work very well. They work fine for people who get a massive subsidy, but for people who are kind of making maybe more than $60,000 to $70,000 a year,
right.
I think a public option as a fallback that polls at 70% the last time I looked. So I think that's the kind of thing we think is the most likely to happen as a compromise, because nobody's really going to go to the mat and say, gosh, these exchange plans are wonderful and it's working perfectly.
I'm sorry to keep jumping in. We have less than just a couple seconds left, John, but what would that mean for UnitedHealthcare if that becomes a reality, that public option?
Nobody really cares about the exchanges except for just a handful of companies like Centene. So it's not. If you look at the insurance companies, they make their money in Medicare Advantage and commercial and in Medicaid. The exchanges are a footnote at this point.
So you'd say it's the Medicaid exposed who are basically the ones who could get hit by that move to a public option.
Right. And look, Kelly, I mean, about 10% of the country needs some help at any time, doesn't have insurance. And I do think a kind of a Medicare backstop or something like that would probably not cost any more than what we're already spending and would probably be pretty popular.
I want to talk more about this. John, please come back. We really appreciate it.
All right.
John Ransom, great stuff. Raymond James, healthcare equity.